rash on the palms of the hands there. And here's the rash on somebody's body. In the skin rash, the spirochetes are present in the vesicles, loss of hair, malaise, mild fever.
You sound like somebody who hasn't gotten it treated.
They don't tell me that in the pictures. I just steal them off the internet. They may not even know, well, you think you would know if you had a chancre, but maybe they don't know what the symptoms are. A lot of people have things and don't go to the doctor, you know.
But I mean, is it normal for you to get the rash all over your body like that?
I don't know, but he has it all over.
Yeah.
Latent period, there's no symptoms. After 2 to 4 years of latency, the disease is not infectious unless you're a female and you become pregnant, and then you can spread it to your baby. The majority of cases don't progress beyond this stage, even if you don't get treatment. Who is somebody that was famous from the olden days that died of syphilis?
Al Capone.
Al Capone. Yeah. He went to the he went to the tertiary stage. The tertiary stage is many years from the onset of the latent stage. And today, you don't see people getting into this because we have antibiotics, and hopefully we're catching them before they get to this stage. But if you do go into this stage, then you can develop humus in your tissue, such as your liver, skin, bone, cartilage. And they're lesions, and they look like rubbery masses of tissue. And if they affect an area that wouldn't be vital, to your existence, then the disease isn't life-threatening. And there's still syphilis around, but I've never ever heard of anybody, myself personally, I've never heard of anybody having syphilis. But they say it's still around. Cardiovascular syphilis can weaken the blood vessels and cause them to bulge and burst. So if you have an aorta that bursts, then that can cause instant death. It can also damage the aortic valves. There's a picture of those gumas, and I think your book has some great pictures of it as well. Who's that? Here's another one on somebody's face. So the latent, this is a different author kind of summing it up. So the latent period can last up to 20 years. Antibodies against the bacteria are present at this stage, but you can't detect the bacteria anymore. Tertiary stage is rare today. Talking about those gumas, that's a characteristic of the tertiary stage. Neurosyphilis involve any part of the nervous system. Gumas that develop in the nervous system can lead to paralysis, dementia, loss of speech, sight, hearing, bowels and bladder, everything's going. And this is what Al Capone was at, the tertiary stage. I think he had neurosyphilis or something. Treatment is penicillin in primary and secondary stages. But if you're to the tertiary stage, then the antibiotics aren't going to help you. Spirochetes can cross the placental barrier in pregnant women and cause congenital syphilis to the fetus. So here's a child that was born with congenital syphilis. There's that spirochete from the mother crossed with placenta. You can get stillbirths with when the fetus is infected. There's a condition called snuffles, where the baby has a profuse nasal discharge and it affects their breathing. And then a sign of somebody that has this congenital syphilis is what these teeth that are called Hutchinson's teeth. They're notched. You see them here. Here, these are notches, and their teeth. Pregnancy during the primary or secondary stages of syphilis usually result in stillbirth of the fetus. If you treat the mother with antibiotics during the first 2 trimesters, it usually prevents them that congenital syphilis. If the pregnancy is in the latent stage, then the fetus may suffer from mental retardation and neurological symptoms. So that was bacterial. There's also viral disease of the reproductive system. One of them is quite common, called genital herpes, an STI. Herpes simplex virus is the pathogen, type 2. However, type 1 can also cause genital herpes. It affects the external genitalia and it causes painful lesions in about 1 week after exposure. Fluid-filled vesicles. So these fluid-filled vesicles will rupture, and then they form these painful ulcers. So the vesicles contain the virus. However, the virus, if you have herpes, that virus can be shed without any apparent lesion. And the virus has a lifetime latent period on nerve cells. So it can be reactivated at any time by stress or illness. Menstruation can cause it. It's like a cold sore. That's herpes 1, type 1. You've seen people that have cold sores, and every once in a while they'll have a cold sore in the same spot. This has got reactivated. Neonatal herpes can be passed to a fetus by an infected mother through the placenta or during childbirth. And it can cause neurological problems or mental impairment to the newborn. So if the mother has an active case of lesions at the time that she's due to give birth, a cesarean section is advised. So these are the vesicles of genital herpes. These are fluid filled with the virus inside of it. This is a picture of a little baby that has had neonatal herpes. They get outbreaks of these vesicles all over them. And this isn't an eye. When I first saw that, I said, "Oh my God, is that an eye?" But these are vesicles. Vesicles all over the baby. can affect brain and internal organs and they can have lifelong disabilities. And treatment will be acyclovir intravenous. Another viral disease is genital warts. It's also known as condylomata accumulata. The pathogen is the human papillomavirus, DNA virus. So it is sexually transmitted, and the papillomavirus can cause growth on the penis or vagina. And the warts are pink and moist. Genital warts has been linked to cervical cancer. Now we have some vaccines, Gardasil and Cervarix, protects against the cancer. With certain strains of depending on what strain the papillomavirus is. So here's genital warts around the head of the penis there. You can see the growth, pink looking. Let's see. And because about 100 types of the virus, there's lots of strains of the human papillomavirus. So 16, 18, 31, 33, and 35 are associated with cervical cancer. Fungal diseases of the reproductive system. One is candidiasis. Pathogen is Candida albicans, and it is an opportunistic dimorphic fungus. Remember, we said Candida albicans is part of our normal microbiota. So it's opportunistic in the way that if your yeast and your bacteria keep themselves in check, they are living in harmony. So, but if you take antibiotics that are killing off the bacteria, then you can get an overgrowth of the yeast, causing this candidiasis. In normal, so normally one of the bacteria that you have in the vagina is lactobacillus, and that one produces lactic acid, so that makes an acidic environment, and that kind of holds it in check. The Candida albicans. It can grow on mucous membranes of the mouth, the GI tract, and the genital urinary tract. Oral candidiasis is also known as thrush. You can see it in newborns. Nursing newborns get it oftentimes. So it's something that affects AIDS patients because their immune system is down. Vulvovaginal candidiasis is the most common cause of vaginitis. And symptoms are severe itching, a thick yellow cheesy discharge. And predisposing factors are uncontrolled diabetes, being on antibiotic therapy, being pregnant, or if you're on the birth control pill. Those are all predisposing factors. And when we said Candida is a dimorphic fungus, that means it has two forms. One form is the yeast form, and Candida doesn't really have hyphae, but it makes pseudo-hyphae if it wants to invade tissue. It isn't a real hyphae, but I think I have a picture. Ah, there it is. So these are the yeast cells.